Fibroadenoma is something else that's not extremely uncommon. It is a benign, non-tender tumor in the breast. Usually see it from adolescence to about 35 years of age. They'll feel a little encapsulated like mass. Don't have any pain or tenderness. Uh, Cause we don't know. Um, they do tend to grow in relationship to hormones, though, so that might have something to do with it. Diagnosis is based on palpation and then ultimately getting an ultrasound or a mammogram. Treatment: surgical removal of the tumor under a local anesthetic, probably just injection in that area. Prognosis is good if there's no complications. Um, and the first thing they're going to do is make sure that it is truly a fibroadenoma and not a malignancy. Breast cancer usually comes from a ductal lobal part of the breast. Um, Usually very hormonally responsive, so it responds to hormones, in other words. Most common cancer for females and the second leading cause of cancer death. Um, Highest mortality is uh, for women who are 35 and older with an aggressive tumor. Um, 30, and then up to 75 because their immune system at that point cannot fight it off as well. So the younger, if they're more aggressive, and older, because their immune system can't fight it off. In most cases, the earliest breast cancers are found by mammogram, so they're not. It's before the stages where they could even be felt. Um, Typically, if they're felt, they have a lump. They may have a little dimpling of the skin, a little ulceration or retraction of the nipple. The breasts may look different sizes if you were to look at them physically, or look at them in a mirror. One size might be a little larger than the other. In more advanced stages, then they'll develop a nodule that'll attach to the chest wall, and be found in the as masses under the or in the axillary region. Um, we typically don't see a lot of breast pain specifically with breast cancer in these stages. Risk factors for breast cancer increase as patients get older. Predominantly, it's female by a huge number, about 100 times more breast cancer is found in women than in men. Um, Prolonged use of endogenous estrogen or estrogen that is uh, has receptors typically. Long-term use of estrogen or progesterone hormone replacement therapy is actually a risk factor for breast cancer. According to the later studies, there's been a disagreement for a number of years. Prior history of breast cancer means there's much likely a chance that breast cancer will reoccur. And then alcohol usage is another potential cause. 90% of breast cancers are found on as an abnormal mammogram finding, probably just on a screening mammogram as well. Um, the rest are found by physical exam, which is not when you want to find them. Um, it's better to find them then than not find them at all, but you prefer them found earlier. Um, and they'll look at whether they're a solid mass or they're a fluid mass that can make a difference. Um, they typically will do a biopsy of anything that is suspicious. Um, and typically, if it's more advanced, they're going to do a CT as well. And then they're going to look at whether or not it has estrogen receptors. Patients that have positive hormone receptors may be treated differently. Um, Prognosis for breast cancer is good if the cancer is not spread to the lymph nodes. And there's a 5-year survival rate of about Well, really 100% if it's a localized lesion and not gone beyond that point. Typically in treatment, they will, if it's a one isolated area they feel they can get to, they may do a lumpectomy, removing just the mass and a little tissue around it. A mastectomy, they remove the whole breast and lymph nodes, and then the treatment from there would be radiation, hormone therapy, or chemotherapy, dependent upon the type of cancer that's involved. Prevention of breast cancer uh, would be things like having a baby before the age of 25, breastfeeding for at least 6 months after delivery, avoiding weight gain, and the use of alcohol, taking tamoxifen and raloxifene for 5 years, and that's specific for certain patients who have had breast cancers already, and then regular mammogram screening. It's recommended that patients 40 years and older have a mammogram every 1 to 2 years, um, and anyone who has a suspicious um, exam or particular risk factors may also be recommended to do screening. Hedges disease is a malignant adenocarcinoma. Uh, Signs and symptoms: crusting, serum or bloody discharge from the nipple and nipple retraction. Treatment: typically, this is one where the breast can be saved with. Um, they may do radiation and surgery if surgery's done. Um, and 20 to 60% have a 5 year survival uh, rate without a mass of 90 to 100%. So that's for breast cancers, that's a very high and significant amount of, of survival.